Hello and welcome back. My name's Ro, I'm a psychologist from Sydney, Australia, and I'm adjusting my camera, and welcome to the Psych Diaries. Today I'm in the clinic, but I have a 1 hour block and I just wanted to sit down and have a chat about what types of clients, what type of cases, what do I do as a psychologist. It's interesting because me and people in my cohort might be actually working on very different things depending on what sector, but I did want to talk a bit about what private practice and just general psychologists might see. And these are the most kind of common disorders or common reasons why people might go to a psychologist. And so today we're just going to brush through a few. It's going to be pretty cash. And yeah, if you're interested, then keep on watching. Right, so I personally work at an adult clinic and a child clinic. And I work in private practice, which basically means that I'm working within the community. And there are kind of two main sectors. One is in public health, which is within the hospital or New South Wales health system, and the other is private practice. So these are your typical psychology clinics that you might see in different suburbs, and the psychologists who are working in private practice generally see clients who are like mild to moderate. They're doing okay, they can manage just with the GP and the psychologist, and when things get a bit more severe or when we kind of require a bit more support, we might transfer those clients into the public health system. And so that's where they might actually have a whole multidisciplinary team, and that basically means that you have professionals from all different types of disciplines. So you might have psychologists, psychiatrists, a social worker, you have occupational therapists, physios, dietitians, and so you've got a whole team around the person, which provides much more of the care that they might need at that time. That's kind of how the system is supposed to work, and maybe if people get discharged from the public health system or an inpatient unit, they might transition into private practice and community. We kind of juggle different roles. For my undergrad, I worked within the community health or public health system, and I definitely saw more severe cases. But right now I'm just going to talk about what someone generally working in private practice might see. And as a fresh grad, I'd probably say that 80% of people are working within private practice because there are very limited hospital roles. And so this is probably what most people will see if they start out as a psychologist. Right, so I'm going to start with adult and then I'm going to go to child, and I have my laptop here, so I'm just going to jiggle that across. So probably one of the most common things we see is depression, and depression is characterized by low mood, feeling down, lacking energy, anhedonia. And depression is really common and also something where we have a very, very good evidence base of how to actually work on depression. And most people can actually see quite quick gains if they're applying the concepts. I personally, probably more than half my adult clients have come primarily with a diagnosis of depression, and usually we're working with cognitive behavioral therapy, and within 6 to 10 sessions we're hopefully seeing quite significant change from maybe they aren't functioning very well, or they find it really difficult to attend work or study, to they're able to re-engage. And so that's classified under a mood disorder. And then you've also got a whole other branch called anxiety disorders, and that's probably the second most common. And so under anxiety, we have both kind of general anxiety and stress that I think a lot of people, in fact I'd probably say everyone, experiences to some degree. And I do see quite a few of those types of clients who might not actually meet criteria for a specific mental health disorder, but they are undergoing psychological distress. So examples of this are adjustment. So if someone's going through a divorce or a death and they're grieving, if maybe they've lost a child or someone close to them, what else would there be? Like health crises, maybe they've recently been diagnosed with something. Just life changes, things that happen to all of us that might lead to some sort of psychological distress. So typically those types of cases we don't see quite as long. A couple of the clients I had, you see them for 3 to 4 sessions, and they kind of feel like they have a space to be heard, to talk about what's happened, and you might give them a couple of strategies to use. And then usually people who come just for an adjustment or just a life stressor, we usually discharge pretty quickly. And then we also have people who would actually fall under the category of there's an actual diagnosable disorder. And so that's where you might see things like social anxiety disorder, specific phobias where you might have heard of, spider phobia, public speaking phobias, germ phobias. And so those require a little bit more work because you've got I guess it's gotten to a level where it's really impairing someone's day-to-day life and their functioning. And so I've written some of these down. You might have obsessive compulsive disorder. I think I have 2 clients with OCD. Generalized anxiety disorder. This is characterized by this kind of overwhelming worry that permeates all aspects of life. Worrying about the future, worrying about family, health, judgment, work, and so it really feels like the worry is taking over someone's life, and also the inability to shut off the worry, feeling like it's taking control of us. Social anxiety, panic disorder. The thing that separates something from being a adjustment or a life thing to an actual disorder is if they meet certain criteria in a Bible that we have, Psych Bible, called the DSM-5. And so usually what happens is people go to a GP and they get a referral. Maybe the GP makes a diagnosis, or maybe the GP just refers to us as psychologists and then we make a diagnosis. And yeah, you typically expect that people with a diagnosis will probably require a bit of a longer treatment, maybe like 10 to 20 sessions, and that's highly variable as well. So yeah, that's our second kind of block. And then third, we've got your more chronic disorders. I don't see these quite as much in private practice. I saw much more of these in public health. And so actually day to day, I don't have clients who present with any of these right now, but they're things like schizophrenia, schizoaffective disorder, bipolar disorder, enduring personality disorders. Within a public health system, you've actually got people like psychiatrists where we work really closely and we do a lot of team meetings together, and people who have some of these more chronic disorders might commonly disengage with some aspects of life because it gets really tough. So you might also need a social worker to link them back in with employment or housing. And so it's much easier to help support people with more chronic conditions within a public health system. That's probably why I don't really have that many clients with these more chronic conditions. And I'm glad that we do have a public health system, because when you're engaged in public health, the services are completely free. All right, so that's all adult stuff. And then we've also got child. So I'm currently in my child clinic today. I personally see kind of a few main buckets at this particular child clinic. The first one is emotion regulation difficulties. This is characterized by really big feelings. You might see the child who has a big behavioral outburst. They might be kicking, screaming, yelling, punching, scratching other people or other children, their parents, themselves. Or you might see them as just being defiant or oppositional. And the reason I do this is because we often say that children aren't trying to be difficult, and often it's just a sign that they have really big, overwhelming feelings that they don't know how to manage, and it comes out as this big kind of aggressive or violent outburst. And so the idea is not to make them less oppositional or more well-behaved or like respect their parents. The idea is actually we're working on their emotion regulation, and so they're able to self-soothe, they're able to use their parents and their support system to help calm down, and that'll actually reduce the level of severity for their behavioral or emotional outbursts. So I'm quite strong in not labeling children as being oppositional or having conduct disorder, and thinking about it more from that emotion regulation side of things. So that's a really big part of our practice. Then we've also got a lot of kids who feel anxious and their parents kind of want to work on confidence, bravery, maybe kids who have difficulty getting to group activities, after school activities. They might have specific phobias like sleeping alone at nighttime, the dark, going to shopping centres. And so I personally see clients individually for that, but I also run a Cool Kids group, which is a group program for anxiety. And I think I've talked about it before. It's really fun. I get 4 families and we work together for 10 weeks and we work on tackling the cognitions or the thoughts that drive anxiety, as well as doing more things, brave behaviors, getting out there and experiencing more things and kind of pushing ourselves and doing exposure therapy. So I love working with anxiety. And the third bracket is working a bit more with neurodiversity. And so people whose brains are actually wired a little bit differently, they might actually see the world a little bit differently. And it's really important that we work in a strengths-based way. And so this is where we're thinking autism, ADHD, maybe specific learning disorders. And we're thinking about neurodiversity as opposed to like issues or problems, because we're really moving away from autism or ADHD being just negative or just bad towards really embracing some of the strengths, working on adjusting the environment, working on adjusting expectations. And we know that so many people on the spectrum are incredibly successful pioneers in their field, from Greta Thunberg, who's like pioneering climate change work and action, to Temple Grandin, who's another woman on the spectrum who revolutionized the like meat packing industry to make animals feel safer and calmer. Oh gosh, there's so many. It's actually, I've blanked out. But so many people who are incredibly successful in their fields have some form of neurodiversity. And so I love working in that kind of more strengths-based way. I think those are our big ones. Oh, and then sometimes we also see adjustment cases. So I do have a couple of clients or families where they're going through divorce, they want to work out how to support their kids emotionally, and we're doing a little bit of kind of working with the parents to develop a bit of a plan for how to support them between two households, maintain consistency. One thing I don't do is get involved in court cases, law stuff, custody battles. Those are not my expertise, and we usually refer out if people require some sort of like court appearance or notes and stuff like that. And there are psychologists who specifically specialize in that kind of stuff. I think that's it. That's a pretty brief overview. Obviously, I haven't talked about every single thing that I have seen or cases that are in the clinic, but these are probably the most common cases that you'll see both at adult and child clinics, and I really enjoy it. I really enjoy having a bit of a mix as opposed to just working with one population. I like the ability to formulate or understand people both in childhood but then also into adulthood, because you're kind of putting on two different hats to do that work. And yeah, I guess that's our wrap up. I hope you enjoyed today's video. Feel free to let me know if you have any questions down below. Thanks for watching as always, and I hope you have a lovely day. Bye.